Hi friends, today I am going to discuss a little bit about Marfan syndrome. Marfan syndrome results from an inherited defect in an extracellular glycoprotein, fibrillin. This is an extracellular glycoprotein, fibrillin. It is present on chromosome 15. There is a defect in chromosome 15 which codes for fibrillin, and fibrillin is defective in Marfan syndrome. It generally inherited as autosomal dominant disease. Coming to pathogenesis, defect consider this as an elastic fiber. This elastic fiber contains a central core made up of elastin. This is the central core made up of elastin. This is surrounded by peripheral network of all these microfibrils. These microfibrils are rich in fibrillin. These microfibrils are rich in fibrillin. Defect in fibrillin causes defective function of this elastic fiber. All elastic fiber will be defective. These microfibrils containing fibrillin are mainly distributed in aorta, ligaments of joints, and ciliary journals of lens. This causes bilateral subluxation or dislocation of lens, referred to as ectopia lentis, typically in superior temporal direction. If consider this as an eye, there is a subluxation or dislocation of lens, typically superior and temporal direction, like this. Here, normal lens position is here, and in subluxation or dislocation of lens, this lens will be moved to superior temporal side. This is called dislocation of lens. Coming to aorta, dilatation of ascending aorta owing to cystic medial necrosis. There is a loss of medial support, results in progressive dilatation of aortic wall ring and the root of aorta, giving rise to severe aortic incompetence. This is the normal aorta. As a result, there is a dilatation of ascending aorta. Ascending aorta will be dilated. This is also one of the clinical features of Marfan syndrome. Ascending aorta is dilated, and there will be MVP, which is called mitral valve prolapse, which leads to mitral regurgitation, MR. This may also occur in Marfan syndrome. There will be a dilatation of aorta as there is a defect in fibrillin genes or elastic fibers. There is a defect in elastic fibers, so aorta loses its elasticity and becomes dilated forever. Coming to some skeletal abnormalities, a patient will be unusually tall. Fingers and hands are long and slender, have spider-like appearance. This is called arachnodactyly. What is arachnodactyly? Fingers and hands are long and slender and have a spider-like appearance. Arachnodactyly. Some pediatric related thing in Marfan syndrome is arm span is more. Consider this as a person. He is usually tall. This person will be usually tall, and when we measure the arm span is the distance between from one end to this end of the hand when stretched perpendicularly to the body axis. When this is more than, this is called arm span. Normally arm span will be less than the body length or body height. In Marfan syndrome, this arm span will be more. This is one of the important bits you have to remember. And there will be some chest deformities like pectus excavatum, pectus carinatum. It's Scoliosis may occur, and it is accompanied by kyphosis. Kyphosis. These are some of the things you had to remember in Marfan syndrome. First thing is it is autosomal dominant, and the defective protein is fibrillin, which the gene which codes for this fibrillin is present on chromosome number 15, and there is a disorder in elastic fibers which result in dilatation of aorta, and there will be subluxation or dislocation of lens, and some it also causes mitral valve prolapse, which leads to mitral regurgitation. And at last I said about arm span. Arm span is more than the body length. This is something about Marfan syndrome, which is important thing for our PG preparation. Thank you, and please subscribe if you like the video.